Now, you mentioned something there that, some people do get the bat to the shoulder. They know why they have the pain. They may not know
Right.
why it turns chronic, but they know that there was an injury, acute injury, something happened there, sometimes sports related or physical related. But are you seeing more and more people? Because I would think more and more people are less and less active in some ways, but there's still so much pain out there, meaning the person that just wakes up with the neck pain, that has the chronic back pain, but never actually lifted weights or did anything or was in an accident before. Is that becoming more common in your practice?
Oh, absolutely. And I think everybody would agree with that who's in the healthcare field. That's why we're having an explosion in chronic disease,
Yep.
chronic pain. Those are the more difficult ones to get a handle on because, like I said before, medicine is very good at finding, one culprit, one cause,
Yeah.
bat to the shoulder. Well, there you go. Or they're looking for something that might be, a bacteria or infectious agent that, okay, that's it. I know exactly what to give you. We're going to take it out. But when you're dealing with chronic pain and chronic disease, the dirty little secret is it's never one thing.
Yeah.
It's a culmination of, it could be 10, 20, 30, but also the culmination of your entire life from the moment that you were born. That's why it's it's a slippery slope when you start to treat a diagnosis because one, the patient can become the diagnosis label that you gave them.
Yes.
And that becomes their quicksand sinkhole that they never get out of.
Mm-hmm.
And then two, you treat all the people the same way most often. Well, here's the protocol that you do for XYZ. Here's the protocol for like a leaky gut, for instance, or say, well, yeah, everybody's body parts are different, right? Because a different person is carrying them around. They're going to respond. They're not going to respond the same way to the program. So that's why people say, I did this, and it didn't work. Well, that's where you have to go more of the individualized medicine. And the way that you practice individualized medicine is, I have a novel idea. How about you talk to the individual in front of you? And you go through their history and you do a really great hands-on manual assessment, which is one of the biggest missing components in medicine today, is that we test, and we never talk and we never touch. And you will never find things on a test that you can find when I talk to you. And even more so when I get my hands on the body. So there's a art and a science to medicine. And that art has to come from getting your fingers in the paint. You understand? Yeah. And laying down some canvas. Because for instance, I have people that say, okay, well, I don't have any issue here because nothing showed up on, let's say, your abdomen. Right. First of all, they're going to say, why are you looking at my abdomen and my shoulder hurts? I'm like, well, because it sits in the middle of your shoulders and your hips. That's why. And they said, I didn't see any problem there. There's no issue because I don't have any symptoms. Right. But then you get them down on a table and you just place your hands lightly on the abdomen and you can actually visibly see a person's nervous system go into a fight or flight response that shows the system is getting very anxious because you're getting close to something. And then when you push in just with a little bit of pressure, they go, ow. And then my point is, it's not supposed to be an ow when I press into your abdomen. And I'm going to contend till the day I die that ow is going to be one of the contributing factors to the pain you keep pointing to. But nobody knew it was there because nobody took the time to stick their fingers there to find out. Right. And then that's how you find inflammation. Because in my world, chronic disease is inflammation. And then inflammation is going to cause pain somewhere. It doesn't mean, this is where you got to hang on for, it doesn't mean that the pain is necessarily where the inflammation is, or, you're allowed to have more than one side of inflammation and you're allowed to have more than one problem. And then you have to, so what I look for are all the areas of inflammation and pain that you don't know about that you haven't been pointing to.
Yeah.
And if I go after those, very often you start to feel a little bit better in what you're doing.
Yeah. And most people, I believe, think that inflammation is due to some injury, infection, something that is, a physical thing. Whereas we understand that it could go much deeper. Inflammation could be caused by toxicity. It could be caused by emotional trauma. It could be caused by many, many different things. Even nutritional deficiencies can lead into that as well.